dogs. Okay. Okay, so I'm going to show you a video of this little interview I did with a person about how they feel depression is to them.
Depression is like being complete loneliness. It's like being a completely different person.
Do you think that depression affects your life?
Yes.
How so?
You can feel happy one minute, sad the next. You feel like there's no reason or no purpose to move. It just completely changes everything about you, mentally and physically.
According to the World Health Organization, depression is the most common illness worldwide and the leading cause of disability. They estimate that 350 million people are affected by depression globally. A lot of members of my family have depression, so I was raised around it. Not only am I raised around it, but I also work in it. I work in a psychiatric unit with people with behavioral health, and one of the leading one is depression. So let me tell you more about it. Depression is a common but a serious mood condition. J.K. Rowling once said, "It's so difficult to describe depression to someone who's never been there, because it's not sadness. I know sadness. Sadness is to cry and to feel, but it's that cold absence of feeling, that really hollowed out feeling." Depression is a mental illness that people suffer from. A mental illness is a health condition that involves changing in your emotion, thinking, or behavioral. Depression can also be all three. It's like being trapped in your head and you just can't get out. Personally, there's days where I don't even want to get out of bed either, but I have to. There are people with severe depression that can't get out of bed at all. Many people take for granted the smallest tasks they do in life, such as brushing their hair, their teeth, or getting out of bed. For people with depression, that's a big achievement because they're actually doing something. So here's this little picture that I found, and it was like the person's telling the little girl, "You had so much energy yesterday and you got so much done." And then today she's just laying on the ground. According to the Mayo Clinic, you may have had trouble doing normal today activities, and sometimes you feel as if life isn't worth living. I see many members of my family struggle with depression, and they can't even get out of bed to go to family events or to the grocery store or anywhere because they're afraid to. Signs and symptoms. According to the Anxiety and Depression Association of America, a major depressive episode may include feelings of hopelessness, worthlessness, helplessness, loss of interest in hobbies and activities, decreased energy, irritability, thoughts of suicide, and many more. Depression can leave you empty inside to the point where you don't care at all or nothing seems right. Michelle Obama once said, "Whether an illness affects your heart, your arm, your brain, it's still an illness, and there shouldn't be any distinction." We would never tell anyone with a broken leg that they should stop wallowing around and get it together. We don't consider taking medication for an ear infection something to be ashamed of. We shouldn't treat mental illness conditions any differently. Instead, we should make it clear that getting help isn't a sign of weakness, it's a sign of strength. And we should ensure that people get the treatment that they need. Even though depression is common, there's many different ways to deal with it. Depression can be helped, and treatment isn't a one-size-fits-all. It's a trial and error. Not everyone suffers from the same depression. Some medications work for others and some don't. In this chart, the main one that it shows is that people with depression can get helped with professional help and medication. According to the Medical News Today, antidepressants are medications that can help relieve symptoms of depression, social anxiety disorders, disorders, seasonal affective disorder, and dysrhythmia, or mild chronic depression, as well as other conditions. Another form of treatment is like therapeutic groups. As I said earlier, I work on the psychiatric unit. So normally when patients come in for depression, they say 3 to 5 days, and they do one-on-one time with psychiatrists, social workers, and staff members. They have groups that they can attend, and they talk about how they feel, and they try to get their minds off of what's going on with them. Depression isn't something a person should overlook. Now that you're aware of what depression is, the signs and symptoms, and also treatments, I hope that you better understand what it was and help somebody get the treatment that they need.